We have a mock test discussion, image-based questions, questions that require a logical explanation. We will pick up 50 to 100 questions out of the 300 question paper and have a discussion. So let's make the great beginning. I hope you all answered the question paper, the mock test. A 70-year-old man has a 90% blockage of the origin of the inferior mesenteric artery, but he doesn't have intestinal angina because there is a collateral circulation that has taken up. So in that kind of a scenario, what can be the blood supply that can bypass whenever the superior mesenteric artery is inferior mesenteric artery is blocked? So typically one of the branches of the superior mesenteric artery, like middle colic artery, will take over and supply that area which is earlier supplied by the inferior mesenteric artery. So that is the reason it is the middle colic which is the branch of the superior mesenteric artery which will take over to bypass the blood circulation whenever there is a block of the inferior mesenteric artery, is what you have to basically appreciate. The patient, now you are all watching the World Cup of the football. Lot of knee joint injuries, and you know what is a great role for sports therapists. So a 30-year-old man injured his left knee, and when he is put on the edge of the examination table, the left knee can be displaced anteriorly at a to an abnormal gliding is there. That is because of the anterior cruciate ligament injury, and that excessive gliding is demonstrated by the Lachman's test, is what you have to basically remember. A 70-year-old man is brought to emergency, and he is having an abdominal pain, passing of the gas in his urine, and a CT scan is showing the gas in the bladder and edema of the fat which is surrounding the sigmoid colon. So what could be the reason? So typically whenever the diverticulum ruptures, it can form a fistula with the bladder, and the air in the gut will enter into the bladder, and while passing urine there will be gas which will be coming out. So that is typically called the enterovesical fistula, which is very often because of the diverticulitis and diverticular fistula, is what you have to basically appreciate. I am very happy to see a good number of you online. Sorry for a little delay in starting the session. 60-year-old man, he has tenderness in the region distally between the tendons of the extensor pollicis longus and extensor pollicis brevis. That is in the anatomical snuff box. The moment you listen pain in anatomical snuff box, which clinical vignette should fire in your mind when you are taking either a USMLE or a NEET PG exam? You should only think of scaphoid fracture. So this is how the scaphoid tubercle can undergo fracture. You can see the classical radiological appearance, or there can be the waist of the scaphoid, you can see the presence of a fracture. So scaphoid fracture lead to tenderness in the anatomical stomachs, is what you need to remember. A 20-year-old brought to emergency, you can see that there is a fracture in the cribriform plate of ethmoid. That is the place where olfactory nerve will be typically ascending. So that's the reason he will have a problem with the olfaction, is what you need to remember. A 7-year-old boy, very easily he is getting tired while running. X-ray of the chest is normal, and the arterial blood gas, when you have done, shows that typically it is higher in the right hand than in the left hand, and continuous murmur, that is the clue in this word. Very few murmurs, PDA, AV fistula, they are all continuous murmurs. So a rupture of sinuses of Valsalva, they are all few causes for the continuous murmur. So it is a case of patent ductus arteriosus. 50-year-old, her temperature is 38.9, which is about 1 or 2 degrees. and there is a jaundice tenderness in the right upper quadrant, and he is showing an increase of the alkaline phosphatase, which is a suggestive of an obstructive pathology in the biliary tree. So she is a case of cholecystitis because of the impaction of the gallstone in the hepatico-pancreatic ampulla is what need to be remembered. So what are the important clinical symptoms of acute cholecystitis? Manito Cognac says that thanks for acknowledging us. Without acknowledging you, where we will survive as a medical teacher? All our mission of life is because of you, my dear. It is you cracking the top seat in the exam, which is the basis of our life, justification of our existence and life. So, whenever my students stop the exam, when I cracked the top rank while joining MD General Medicine, 10 times the joy I get every time my students are cracking. More joy I get when some student who had a challenge of even qualifying in exam, but this year cracked and came with a sweet box. That is a pleasure. So, acknowledging you, you are the part of our life. Let me tell you, you are the sinus node of a teacher. So, for you we prepare. For you on the afternoon of Sunday we live. So, please be sure that we are with you until you get the seat. So, what are the symptoms of cholecystitis? Sharp pain in the upper quadrant where the gallbladder is located. Pain that is radiating towards the right shoulder because gallbladder and liver are subdiaphragmatic structures. So, there is a pain radiating to shoulder. Pain while you are taking the deep breath because gallbladder inflamed surface is touching. Abdominal pain that is persistent. Jaundice, fever. So, these are the classical combination of clinical features is what you need to basically remember.